Now, we all know that Blessing CEO is a very controversial woman. Like I was saying before, you know that story of where you cry wolf. And this time when the wolf actually does come, the community doesn't believe you. So a lot of people have been debunking her claim, thinking that they don't believe it. So which is why I invited both of you to come and answer this question from the medical aspects to clear the air, you know. So she claims she was given the long diagnosis last July and only found out after her second visit in March when she went to go and see the doctor, that the first doctor didn't tell her that she had it. The doctor said it was benign, that the lump was benign. And by the time she was so busy doing other things, by the time she now finally went in March, they told her that it had spread. Do you understand? So what are the inconsistencies that you noticed about her claim? Let's start with that.
Okay, first of all, she's seen any medical doctor seeing a patient with a lump and saying it's benign. How did the doctor know it was benign? Because you cannot truly know if something is benign unless you do a biopsy. So was a biopsy done? Even if a biopsy was done, if there's a lump in the breast, we don't leave benign lumps in the breast. We don't allow patients to just go around with lumps in their breast unless they are not medically fit. Because the surgery for lumpectomy, it's a minor surgery. So no doctor will allow you to just be carrying lump. I'm not saying it's not possible, but it's not likely because we don't know the type of doctor she went to meet and all that. So that is one. Then number two is, I would have expected that, I was having nausea, it became painful, I had nipple discharge. What were the symptoms that she saw that made her go for a second opinion? I expected that she would be more transparent because Blessing CEO is someone that we would all agree with, that she's very, very open. When she had cosmetic surgery, she took us along. So I was thinking that, and that is something that is not acceptable, but something like cancer, I would expect her to go into more details into how she was able to come about going for this second opinion. Okay,
let's get to Dr. Akinade. You know, is there because you know some people, they call them hypochondriacs. In other words, they always imagine that they have one thing or the other. But cancer is a tall order. Do you understand? For you to actually come and actually claim that you have cancer stage 4, not that I'm disputing what she said, but I'm just saying that, is there a medical term for people who imagine that they have something that they don't have? Is there anything like that?
I examined to know what exactly she has. So, however, there are some conditions that we can say that, well, she might be suffering from. We have number one, we could have fastidious disorders where the patients deliberately form certain medical conditions. They just be like, okay, I have this, I have that. Some they can even exaggerate very little things. You hear them say they have headache. In fact, they could say that their headache is already brain tumor. So in such cases, there are many of them like that. We also have histrionic traits, personality traits, where you see people who just want an attachment. They want to get this social approval of certain things. So, and then, well, the bottom line is that there's psychological distress.
I just want to say that's it. Okay, but let me ask you again, Dr. Funke. What are the physical, by stage 4, because stage 4 is no child's play by any standard. So what are the physical signs or changes that will probably have been exhibiting on your body before it's acknowledged that it's stage 4? And do you also need surgery? Because she says that she needs surgery to confirm whether it has spread or whether, because she already says it's stage 4, so she wants to do surgery to confirm whether it has spread. So what are the physical signs?
Okay, so as an emergency,
do you need to do a surgery, like I said?
As an emergency room physician, I encounter a lot of advanced metastatic breast cancer every day. So one thing about cancer patients is that they understand their condition very well. So I'm assuming someone like Blessing CEO that is very educated, for her to say stage 4, I expect that she knows what she's saying. So stage 4, we don't do surgery for stage 4. So I don't know.
Okay, what are the things that
okay, so the thing is that
what are the instruments used to detect?
Okay, so for you to even determine for you to say that you have stage 4, it means that it has metastasized. So it has either gone to the brain, the lungs, the bones. So that is basic. So before you do that, you have to do a CT scan. Has she done a chest CT scan? So those are the medical reports I expect her to be showing.
What about the MRI?
Exactly, the MRI of the brain. I expect her to have done PET scan. Those are the things I expect her to show us. Because if you're seeking public funds, as she is, I would expect it is the right of moral, I don't know the legal implication, but morally, if people are going to part with their money to help you, they have the right to ask these questions.
Okay. Can a history of dramatic behavior, for instance, be amplified by social media, drive personalities to exaggerate or fabricate struggles for attention?
Well, in a country like Nigeria, where people have benefited so much from the public trying to put a lot of things on her, either fake, either true, So it means that we have several stories. Because of certain litigations, maybe I do not want to go into several people who have benefited so much from this. However,
this is yeah. Go ahead.
However, in the process of they doing it, there are now lots of consequences that can come, and we have consequences such as people will not trust you any longer, and over time you are even likely misinforming the community. So that's.
But even aside from that, what about those who now genuinely have it?
Exactly.
Because there's also the chance of, if this, none of us is saying whether she's lying or telling the truth, but there's also the chance that if she is lying, somebody else now genuinely has this ailment will now be affected by it. So there's a lot of repercussions from this whole revelation.
Well, some people who have found themselves in this situation, I mean, those who are genuinely sick, it's so painful for them because the public will now, I've seen several times when we see a lot of GoFundMe, people are genuinely sick and people really help them. Now, it now means that if someone now comes now, I'm not saying our claims are wrong, but I can bet it with you that peradventure we now discover that our opinion and whatever she has said is wrong. So it now means that over time, those who are now genuinely sick are now going to suffer more for this action.
There's another one I want to bring out, which also caught my attention, where she was cutting her hair.
Oh,
there was
fantastic.
a video where she was shaving her hair and loosening her hair. So I'm assuming that with cancer, your hair does fall out, and they say once you take a chunk, it just pulls out. So, but can you lose your hair without doing chemo? Because she obviously hasn't done chemo yet.
So
is that possible?
No, actually no.
So unless you're doing chemo, you cannot.
Unless she has a background condition that is not related to that cancer.
Like alopecia.
Alopecia, exactly.
You didn't say she has.
And then most people, the normal trajectory for people that have cancer is that they would start the chemo and start losing their hair before they start maybe cut off their hair. And it's not everybody that would lose their hair. Everybody wants to give their hair a fighting chance that, oh, maybe I will not lose my hair. And there are new technology that you have like a cooling cap when you 30 minutes before you start chemo that reduces your chances of losing hair, because basically the chemotherapy are toxic drugs and they attack rapidly growing hair follicles, which includes the hair, rapidly growing cells, which includes the hair follicle. So that's the reason why hair falls off. So we don't, it doesn't really make sense to me.
It doesn't now make sense.
It doesn't, it feels a bit too dramatic. For me. Yes, it seems performative.
So part of the things they're likely going to have is, there's a whole lot of drama about the condition. So they are the ones, whoever is sick, I can bet it with you. There are a lot of people who have died that it was after they died we got to know what killed them. It's not you coming to say I have this most of the time. And as time goes on, because they have said a lot of things, their history will now not tally again. We now discover that they will now begin to, they might have said something to Mr. A yesterday, and next week they are saying another thing to Mr. B. So, and that's the reason why over time we now begin to, looking at that trend, the drama, the history not correlating, and I can bet it with you, we can get to know that is most likely there's something wrong.
And another thing that's very important I would like to point out is the fact that for cancer is very financially draining. It is, but usually people don't know the financial implication. So they start with their own personal funds, then they hook midway, they run out of funds, then they now seek for funds from relatives before they now come out to the public. She is selling her car first.
Yes, there was a video where she was telling that, trying to sell her hair, trying to sell her wigs, trying to sell her car.
Those are part of the